Well, when looking at any data, it's important to always look at the quality of the evidence, right? And so there's so much evidence out there, and some is going to be of low quality, some of medium, and some of the highest quality. And we certainly want it to be peer reviewed. Our goal is, of course, for it to be independent of the manufacturer when at all possible, and certainly independent of manufacturer bias. When looking at this particular subject matter, the Journal of Arthroplasty is one where we look at sort of joints. We know that the risk of joint infections is going to be quite significant, not only from a patient comorbidity perspective. These are patients that are coming in typically that have other things that might be going on medically, but you're also going to have a risk of poor outcomes, right? If these patients get a joint related infection. From an infection control perspective, the Infection Control and Hospital Epidemiology Journal is really one of the leading journals for both the SHEA and the IDSA membership. And the American Journal of Infection Control are really the other big journals in this space. And lastly, there's also good peer-reviewed data that supports the Alluvia Sense in the ACS Omega Journal, right? Again, the goal of a literature search is to look at the total picture of data to make sure it applies to the clinical setting that I might be working in, to look at any potential biases, and also to make sure that the data is of the highest quality, the sample size is adequate enough, and the statistical analysis is appropriate. The nice thing about this particular technology is that there are multiple sources of evidence that are published in the peer-reviewed literature in those different sources that I mentioned. And that really gives me the highest level of confidence that technologies like this, that are autonomous, that are well studied, published in the peer-reviewed literature, really are going to help bring me additional validation of my efforts to reduce surgical site infections, both in perioperative settings as well as other healthcare settings.